The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. Excited for today's guest. Having a great conversation before the episode. I love it when that happens. Kristopher, I know you go by Chris, but I'm going to call you Kristopher now. Cherry, say hello to everyone.
Hello, everyone.
Hey, let's just jump right in like we always do. Again, thank you for your time. Tell me, how'd you get involved in dentistry? How'd you end up where you're at?
Oh, wow. How I got involved in dentistry is kind of funny. I was actually playing soccer overseas, and when my career was ending, my mother actually was saying, "What's next for you? What do you think you're going to do next?" And she actually pulled, I believe it was an ad for Comet USA, which is a burr manufacturer. I have no idea what to do with dentistry. I didn't even know what a burr was. Sure. And managed to get the position as a rep in New Jersey. And the best way to describe burrs, as when I was first learning in that side of dentistry, is that it's more of a carpentry side. You're dealing with burrs that I never knew what was used is a diamond to shape and mold teeth for your crown and bridge prep. So it was very eye-opening experience with my first step into the dental world.
Yeah, how was it like getting that job? Was it a little nerve-wracking? What was your first experience like there?
Well, it was very intimidating because it's a very technical thing to be dealing with. And I didn't, like I said, didn't know exactly what it was, didn't know how you would use it. I just knew that they were used to shape, your teeth for crown and bridge prep. And then the training that I received at Comet, it prepared me for that first step to be acclimated to the dental world, to know the verbiage and to learn how to help doctors in that aspect of their practice. And then that led me to my next step into the dental world, which is VOCO, which is more of I like to coin it as the mad scientist side, learning about monomers, learning about resins, learning about bonding agents. So it was like the next evolutional step in that dental world.
Got it. So I know VOCO is based out of Germany, but they're kind of making a splash here in the U.S.
Yes.
And we'll get into that in just a little bit. So knowing that VOCO is providing quality dental products and helping dentists with a lot, right? I mean, you got a lot of different products. I'll let you get into that in a minute, but tell me, what are some of the problems that you see when you're talking to dentists? What are some of the reoccurring problems and themes that you're seeing them have that we can talk about solutions for?
Oh, well, it's actually funny you mentioned that. I was listening to the podcast you had with Dr. Colleen, and I wholeheartedly agree with one of the problems that a lot of doctors are seeing is when they order from like a Net 32 or some of the gray market, I should say, is that with the gray market, what that does is the doctors thinking that they're getting that top of the line product, that genuine VOCO, let's say, or Moran, and it isn't, or it may be something that's now a defective product that somehow found its way onto the gray market that doctors are buying at a deeply discounted rate. That hurts in the long run because when I go in to speak to these doctors, they say, "Oh, I already have your product, or I already bought your product." And I didn't like it because the crown failed or the composite kept failing. And that's when I do a little bit of detective work and find out that the doctor was doing a lot of gray market purchasing.
Now, gray market is secondary markets, right? Online marketplaces where you can buy products. It's not just in dentistry, it's in everything. But a lot of these products, what you're saying, has a high potential to not be authentic. I years ago was given a gift. I felt bad for the person that gave it to me of a golf driver. I love to golf. And it was a titanium driver. I started looking at it and it kind of felt a little weird to me. Like the quality of the head cover seemed a little off. And I just happened to be standing next to a refrigerator that had a magnet on it. And I took the magnet off the fridge and it stuck right to the face of the golf club, which would only happen if it was steel. And I was like, oh, geez, this isn't legitimate. I ended up calling the manufacturer. They're like, yeah, it's not. They ended up giving me a nice discount off of a new driver by giving them the fake one. And they wanted the fake one so that they could use to kind of figure out, maybe where this came from and do some investigating. And the healthcare industry and pharmaceutical, great market, and even maybe black market, right? If you're not getting the product that you think it is, I would call that a black market.
Yeah.
It's a huge problem, right? We've seen fake Botox out there. I mean, do some Googling on that. I mean, we've seen a lot of I saw 60 Minutes years ago where they're showing pharmaceuticals coming in through legitimate distribution centers, ending up in drugstores that have big brands that literally had none of the active ingredient in it. Nothing. I mean, if it's a
Yeah.
late for death matter, they're not getting there. And so this is happening with everything. So how do you go from, I think people are on the gray market because they're trying to save some money. If they're getting the bad product, they're actually costing themselves money, right? And time.
Yes.
What other benefits are there from going direct to the suppliers and the manufacturers and avoiding these gray markets? What are some benefits that people don't typically think about?
Patrick, I like to express to all my doctors that they're not only purchasing our products through our distributors, but they're also purchasing my services to help troubleshoot, to help kind of nip anything in the bud early on,
Sure.
with the products they purchase from us, because there's nothing really absolute except uncertainty, right? So I like to
Yeah.
be able to provide that kind of, I would like to say, kind of like a caregiving attitude towards my doctors, because, I take more of a consultative approach to trying to help them with their practice. Because let's face it, I mean, they do have to run a business, and I want to make
Sure.
sure that business is successful, because then I mean, I don't want to say it's a selfish way, but then I also benefit from that as well. But I really like to make sure my doctors are taken care of. That's one thing I pride myself on, is that customer service. I kind of package that into why they need to go through the correct course of purchasing our product.
Sure. Yeah. I mean, you can get a really good quality steak through the mail now. Snake River Farms,
Yeah.
that's like something we send out to our clients, right? And you can order a Wagyu steak and they'll deliver to
Oh,
your house.
yeah.
You still got to cook the thing. You got to take care of the sides. You got to make sure that you don't burn it. When you go to, if you overcook a steak at your
Oh,
house, it's toast. If you get an overcooked steak at a quality steakhouse, they're bringing you another one and then probably putting that overcooked one in a doggy bag for your dog,
yeah,
right? So,
exactly.
right, so huge night and day difference, right? I mean, one is a wasted steak, one is an amazing experience. So that type of service certainly matters. There's no doubt about it. So, tell me a little bit about VOCO. What's a little different from you guys? And again, I know you're based out of Germany, but obviously you're here in the U.S., right?
Yes.
Distribution right here in the U.S. So tell me what's a little bit different about you guys and who should consider giving you a call.
Well, what's different about us, Patrick, is our products are not such a technique sensitive product. So, it kind of makes the long run, it takes unnecessary steps out of certain procedures, in terms of like cementing a crown. They don't have to condition a tooth with our Moran cement, which is one of our really top of the line cements. It's kind of like a workhorse cement, good for all substrates, your PFMs, EMAX, zirconia. Now, you don't have to, condition a tooth at all. And that takes out steps that, frankly, could cause some problems for some doctors.
Okay.
So, with our products being less technique sensitive, it can work in anybody's hand, whether it's a GP to a prosthodontist, I should say, to someone who even does a little bit of endodontic restoration or cementing a crown or bridge.
Makes sense to me. So they want to learn more, and you go to the voco.dental, great
Yes.
place to go. But can they get in touch with you, other reps? How's that work?
Yeah, sure. I believe there is a number you can call, or you can send an email to our through that website. And depending on where you are in the US, you'll be directed to your local rep, whether it be myself, which handles the Brooklyn and Staten Island territory, or another rep like Brad, who handles some territories out in the Midwest. So it's really easy to get in contact with us. We make it very available to receive samples, because we believe that's a good way of doctors to feel comfortable with using our products. Now, you won't get that with
Yeah.
the gray market. So that's also another huge factor on why they need to actually contact us instead of going through the gray market.
Yep. I will say, and I don't like fear mongering, but years ago, I saw a lot of doctors end up having licenses suspended. A few, I should say, did, and quite a few ended up having to work under probation
Yes.
guidelines because they had bought product on the gray market. Government prosecutors didn't look at it like that. They looked at it as the black market, not the gray
Yeah.
market. They looked at it as doctors being greedy, trying to save money or trying to make more money, which ended up significantly affecting patient care. And they went
Yes.
after those doctors. And again, I'm not trying to fear monger, but some of these things are pretty serious, as people know. maybe a crown doesn't seem as big as a deal as maybe Botox or pharmaceuticals, but it can open you up for some liability. So I think it's something to definitely look into. I want to give the website one more time.
Oh, thank you.
Yeah, it's VOCO, VOCO.dental. Give it a look, get in touch with your rep, check them out. Chris, thanks so much for taking the time to visit with us today. Really appreciate it.
No, thank you, Patrick. It's a pleasure. Thanks for, having this conversation with me. I found it very informative.